Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. I'm here today to explain about delivery baby. My presentation lecture will take 10 minutes. Before going to explain, I want to introduce myself. My name is Syafika Radhwa Zakira. Now, uh, as you can see, about definition delivery a baby. Delivery a baby is the process by which the baby placenta and membranes are expelled from the mother's uterus. Labor is considered normal if the process occurs at term after 37 weeks without any complication. And the next slide, I want to explain the different kinds of childbirth and delivery methods. First, vaginal delivery. In a vaginal birth, the baby is born through the birth canal. It's hard to know when exactly you will go into labor, but most women give birth at around 38 until 41 weeks of pregnancy. The nation's largest obgyn organization recommends that a pregnant woman plans for vaginal birth unless there is a medical reason for a cesarean. In new guidelines issued in 2013, the American College of Obstetri- Obstetricians and Gynecologists says maternal request cesareans are especially not recommended for women planning to have several children, nor should they be performed before 39 complete weeks of pregnancy. Benefit of vaginal delivery are shorter hospital stays, lower infection rates, quicker recovery, and babies born vaginally have a lower risk of respiratory problems. And the next slide, I will to explain about Caesar section or C-section. Of course, we know that not all births happen the way we plan. When complications arise, other methods of delivery are available. C-section is an oasis of laboratory surgery. Incisions are made to remove the baby from the mother's stomach or uterus. There are six factors that require a caesar operation to be done. Uh, and what are these six factors? First, multiplans are twins, triplets, age. Second, a very large baby. Third, previous surgery, C-sections, or other uterine conditions. Fourth, baby is in breech, are bottom first, or transverse, are sideways positions. And fifth, placenta previa, or when the placenta is low in the uterus and covers the cervix. And the last, sixth, fibroid or other large obstruction. And the next slide, I will to explain about vaginal birth after C-section. In the past, C-section ended any hope of future vaginal deliveries. But today, thanks largely to change in surgery technique, VBAC is possible in many cases. In fact, an estimate 75% of women who try VBAC have a successful vaginal delivery. VBAC isn't right for everyone. Tough sometimes pregnancy complication or underlying condition prevents the possibility of a successful VBAC. Many local hospitals don't ever VBAC because they don't have the staff or resources to handle emergency C-section. And the next slide, I will explain about vacuum extraction. Vacuum extraction. A vacuum extraction is a procedure sometimes done during the course of vaginal childbirth. During vacuum extraction, a healthcare provider applies the vacuum or a soft and rigid cup with a handle and a vacuum pump. The baby's head to help guide the baby out of the birth canal. And the last explain about forceps delivery. A forceps delivery is a type of operative vaginal delivery. It sometimes needed in the course of vaginal childbirth. In a forceps delivery, a healthcare provider applies forceps or an instrument shaped like a pair of large spoons or salad tongs to the baby's head to help guide the baby out of birth, the birth canal. Let's now move to a conclusion of delivery baby. Many hospitals now offer comfortable maternity suite that convert into state-of-the-art delivery room. An easy birth and a perfectly e- execute birth plan are ideal. However, we know that even the most carefully planned birth can take twists and turns. In this case, it's important to be prepared for alternative delivery methods. And just enough from me. I'm sorry if I have mistake. And the last, wassalamualaikum warahmatullahi wabarakatuh.